Hello, parents. This is Dr. Lalit Mittal from Giggles Clinic and my own space. So, this video is about genetic testing and how important it is, and what are the pros and cons, and do all children in autism spectrum require genetic testing, and what are the costs and what are the advantages and disadvantages of doing genetic testing and how fruitful it is in autism. So around this things, I'll be giving a short video on genetic testing in autism. So we all know that autism, in most of the cases, autism has no known etiology or the cause. There might be environmental causes, there may be genetic causes, there may be prenatal causes, there may be a lot of other stress, maternal stress, or unknown causes in which the cause of autism is not known. So, in what scenarios do we go for genetic testing? See, there are only 5 to 15% of the cases of autism where we can have an identifiable genetic cause. Now, how fruitful it is to go for a genetic testing? So, in coming to the various, guidelines, if they mention, according to the American Academy of Pediatrics and various other organizations which are there, or American College of Genetics Society or Genetics Association, they have given different guidelines. Some say that genetic testing is required for all kids who are born, or especially they are gone now. They are going towards what is known as chromosomal microassay. Now, in chromosomal microassay is little more advanced than karyotyping. In chromosomal microassay, we can even detect the small, minute causes, minute deletions, which are considered to be submicroscopic. Means हम जो microscope में नहीं दे सकते, so they cannot be detected by karyotyping. This can be detected by these chromosomal microassays. But taking into consideration, do all children with autism require genetic testing? There are some known genetic disorders which we know, like Prader-Willi, tuberous sclerosis, Fragile X syndrome, Rett syndrome. But the important thing is that when should we consider a child with autism? Is it that a child who is on the severe score of autism requires genetic testing, or it is only every child? See, generally the guidelines, and if I combine the guidelines and recommendations from various societies and everything, it is now said that we talk about in Western, they are going for chromosome microassay for all children. Any child who is born with autism or is diagnosed with autism, they are going for a chromosome microassay. But again, this thing is not possible in India because we have to look into the financial aspects also. There are a lot of parents who have been spending lots of money on various therapies, OTs, there are special educations, various other plans they have taken. So it's practically not feasible in the Indian scenario. The important thing is that we have to discuss with the parents. We have to tell them what are the benefits, and if we are able to make the diagnosis of the child, the cause of autism through genetic testing, then how fruitful it will be, and whether we'll be able to make a proper treatment for that thing. So all these things, they have to be taken into consideration while going for a genetic testing. So practically in India, there are no such guidelines. The guidelines have not been formed, or they have been not recommended, because it's not practically feasible for each and every parent, and we cannot give the guidelines in our children on the spectrum, because we all know that one child in spectrum may not be similar to another child on spectrum. And there is a very nice saying in autism: if you meet one child with autism, you meet one child with autism. Means no two child on spectrum are same. So that is why it's very, very difficult to formulate the guidelines on genetic testing. But coming to the practical scenario, and in taking into the summarizing the various recommendations, and also in my experience, I believe that genetic testing is generally recommended, or we should discuss for genetic testing in children who are on the spectrum. First of all, either first there is a family history of genetics disorders, or there is another sibling who has autism, or there are a lot of seizure disorders, and again, or they may be developmental delays, or the child is mentally retarded, or he's an intellectual impairment. That would be a better word to use. So these all things we have to look into consideration while going for a genetic testing. But again, another important thing is that, for example, earlier, Asperger syndrome, Rett syndrome, and childhood disintegrative disorder, or pervasive developmental disorder not otherwise specified, they were considered to be uh, they were considered to be the divisions of autism spectrum. They were divided into five characteristics among the autism spectrum disorder. But now, as per the DSM-5 criteria, all of these subcategories have been removed, and all of them are now coming under one umbrella, which is known as autism spectrum disorder. So, for example, if I talk about Rett syndrome, see, Rett syndrome, we know that it is more common in females, and what are the side effects? The child may be having hypotonia, he may be having a lot of behavioral disorders. So the important thing is that now coming to this Rett syndrome, the cost of these testing, genetic testing for Rett syndrome costs around 20 to 25,000, and which is practically not feasible for everyone, which will bring about some improvement. So all these things, they have to be taken into consideration, because even if you make a diagnosis of Rett syndrome, your therapies, your workouts, your things, your approach will not change. Only thing is that now you have the diagnosis in hand, but you have to look into consideration that making the diagnosis is more important, or will it change the outlook of the child? Will it change the outlook? Will it change his treatment plan? So these things have to take into consideration while going towards the genetic testing. For example, if I give you another example, for example, Landau-Klempfer syndrome or LK syndrome. Now, most of the cases we have seen children who are in autism spectrum up to 3 to 4 years, they will be absolutely fine, and suddenly there will be regression of their speech, the regression of the language. They will almost undergo to a non-verbal phase, what we sometimes call as mute autism. In that case, sometimes what is called as autism regression or autism regression syndrome, it has been associated with LKS, where there may be sudden loss of language skills, social skills. Along with that, they may be having some mild type of seizures, which are only seen during the sleep. The parents may complain that a child ekdam suddenly ud jata hai, he is not able to sleep, his sleep is disturbed. So what we call as silent seizures. So in that case, we can go for EG. In EG, if it is detecting these LKS epilepsy type syndromes, or detecting which are suggestive of LKS, then we can go for genetic testing. Because in that case, if the child is detected with LKS, in that case, the results are good, because we have to treat with the children on steroids, and the outcome is better compared to those genetic disorders where we don't know whether the outcome will be affected or whether the results will be better or not. So these things, they have to be taken into consideration. Just going for genetic testing for each and every child is not feasible. So, and also, before going for genetic testing, you have to discuss with the parents. You have to tell them that these are the things we are trying to plan, we are looking for the etiology. But definitely, if we are able to diagnose this, if we are able to diagnose the genetic disorder, nothing much will be changed, your approach will be same. Now, if you are willing to go for this testing, we can make the arrangement, because such testing is not available freely everywhere. The cost is very expensive, it takes a lot of time. So all these things, the pros, the cons, the financial issues, they have to be taken into consideration. Why I'm telling all these things? Because just ordering genetic testing for every children who is on the spectrum is not feasible. Because only 5 to 15% they are identifiable causes of genetics, and that too, out of these 5 to 15% of genetic causes which are identifiable, how much of them we are able to treat them? It's very rare. For example, if we go for tuberous sclerosis, they have to be an associated seizure disorder, they have to be associated, other things are there, or they may be multi-system involvement. They may be CNS, or the child may be having severe developmental delay. So these are the basic things we have to look into consideration while ordering genetic testing in children. So I think this was a short video about genetic testing in autism and where we stand right now in this. I hope we were able to gain some knowledge about genetic testing in autism. Thank you.